Since 1857, the St Vincent's Health Precinct has led Australia's reputation and agenda for global health innovation. It's one of few Australian health precincts having impact on the world stage, and yet it's by no means the largest such precinct in Australia. How this impact has been achieved is a story of long-standing legacy, a product of shared values, mature governance, and well-practiced collaboration between its healthcare, research, and teaching precinct partners. St Vincent's Precinct has been the training ground for many of our state's finest clinicians and researchers. Today, the St Vincent's Precinct has amassed nationally unique technical capabilities in clinical genomics, cardiac care, cell therapies, human immune profiling, cellular genomics, and medical device development, all dramatically improving care for patients across New South Wales, around Australia, and the world. In making such an impact on the world stage, the precinct partners have never lost sight of their shared mission to serve vulnerable communities. Today, 1 in 4 patients at St Vincent's Hospital are from vulnerable populations or experiencing addiction, homelessness, or mental illness. St Vincent's serves all of New South Wales. 10% of patients are from rural and regional areas, rising to around 30% within our centres of excellence. Famed medical research institutes, the Garvan Institute of Medical Research, Victor Chang Cardiac Research Institute, the Kirby Institute, and the St Vincent Centre for Applied Medical Research operate on the world stage. 3 on-site university partners, Notre Dame Australia, University of New South Wales, and Australian Catholic University educate New South Wales future clinicians and researchers. Being Australia's first health innovation precinct has enabled partnerships to be formed with multiple university partners across Australia and the world. One of the secrets for success is that many of the precinct's leading researchers are also practicing clinicians who bring clinical insight into the lab to sharpen the focus of research. For example, the precinct's world leadership in understanding immune function and the mRNA technology key to the development of successful vaccines and therapeutic antibodies. St Vincent's Precinct is home to researchers who are internationally renowned for establishing the concept of multiple immune tolerance checkpoints, the framework underpinning cancer immunotherapy. This unique co-location and interdisciplinary leadership provides critical opportunities for the development of new immunological therapies that are unique to the St Vincent's Precinct. Building on decades of globally recognized infectious disease research, particularly in HIV, a team of St Vincent's and Kirby Institute researchers and clinicians recently uncovered an immune profile for long COVID for the first time, potentially paving the way for tailored treatment for those with ongoing COVID symptoms. And another precinct team developed a rapid COVID sequencing strategy adopted throughout New South Wales. Another example of this research-clinician nexus over the past decade is the development of new genomic technologies and platform approaches that will ultimately support diagnosis, personalized treatment, and risk prediction across all diseases. For instance, researchers at the Victor Chang Cardiac Research Institute and Garvan developed new bioinformatic tools to support the early diagnosis of dilated cardiomyopathy long before symptoms arise. The precinct has unparalleled capacity across genomic and cellular genomic sequencing. The Kinghorn Centre for Clinical Genomics is one of Australia's highest capacity genome sequencing and analysis facilities. The Garvin Weitzman Center for Cellular Genomics is a world leader in the generation of cellular genomics data, being the third largest generator of single-cell sequence data worldwide. Global impact with profound health and commercial benefits for New South Wales is being germinated at St Vincent's Precinct day in and day out. The St Vincent's Precinct is defined by its shared values and heritage. The Sisters of Charity founded the core precinct bodies and collaboration partners because they saw the power of bringing together healthcare, research, and education to break through complex health issues, particularly for those who are marginalized or vulnerable. Countless invaluable social justice innovations started at the St Vincent's Health Precinct and have been replicated across New South Wales and the world. St Vincent's continues to push the boundaries with research into new models of care and therapies for marginalized people. St Vincent's has long made clinical trials part of its standard of care, giving its public, private, and aged care patients the opportunity to participate in cutting-edge research trials.
Hallelujah!
The precinct's expertise is in multi-phase and multidisciplinary clinical trials, particularly HIV, viral hepatitis, cancer, neurosciences, gastroenterology, cardiovascular, and palliative care. Its clinical centres of excellence have emerged in response to clinical priority areas, which in turn are a direct response to community need and State's Office of Health and Medical Research priorities. In recent years, there has been a steady increase in industry-sponsored clinical trials across the precinct, with increased investment by multinational pharmaceuticals and medical device companies. In the future, precinct partners aspire to overlay the clinical trials infrastructure and opportunities across our statewide clinical referral services to expand participation beyond Greater Sydney into regional centres. Local, statewide, and global partnerships and impact mean that the St Vincent's Precinct has a broad reach that transcends its central Sydney location. It is, if you like, a precinct without borders. This concept captures the reality that established successful health innovation campuses, such as the St Vincent's Precinct, are engines that fuel a wider innovation ecosystem across the state and the world. Impact that is grounded in Darlinghurst, but shares its influence and economic output with nearby Tech Central across to the Randwick and Camperdown precincts and into the CBD commercial heart of Sydney. However, while well-established precincts often have significant health innovation opportunities, talent reserves, and co-funders, they are often constrained by old infrastructures. They need co-investment between government and philanthropy in state-of-the-art infrastructures in order to deliver on the abundance of opportunity that their reputation and potential affords them. The proposed West Street Translational Research and Educational Centre will support rapidly growing demand for cutting-edge clinical trials to boost New South Wales innovation and research impact. Providing a focal point for co-location and collaboration with industry, the centre will include a hub of translational and preclinical research and development, and an education, training and teaching platform. And the new Carl Cater development comprises an upgrade of existing clinical buildings and creation of a new facility for inpatient and ambulatory services, as well as education and teaching facilities. Both of these innovative facilities call upon the whole community to deliver on their vision and require co-investment that brings together government, industry investment and philanthropy to build on land contributed by the St Vincent's trustees. St Vincent's Health Precinct, Sydney, is New South Wales' original health innovation precinct. Its impact has been woven into the progress of our state and nation since 1857. Right now, we have the opportunity to grow and even transform this proud legacy by investing in the precinct to deliver immediate health, social, and economic benefits for New South Wales and its people. St Vincent's Health Precinct, Sydney. Pioneering research-driven care together.